My late wife once told me about something that shocked my belief. She's a sickle cell patient, and she's also an auxiliary nurse. You know, these people that learn nursing from the hospital directly. So she told me, when we are discussing on how people often do mistake doing, tests for genotype. Some people, when they go and check the genotype, they'll say that they are AA. At the time they go to another lab, they'll say they are AS. Another lab will say they are SS. So I asked her that what could have been causing all these mistakes. So she said that, being an auxiliary nurse, she's been in the lab where the test is being done, where the genotype test is being done. Some labs are so, they are not standard to the extent that it is this auxiliary nurse that they will put in the lab. They will just train them for some few days, some few weeks, and they will tell them to be doing tests. So my wife told me that sometimes when a person comes to do the genotype test, and the real laboratory scientist is not on seat, they will just push one of the students, one of the auxiliary students, to go and do the test for the genotype. And the blood type is not very clear. It's not that maybe the differences is not very well apparent. So it takes some level of expertise, some level of professionalism to know the difference between AA, AS, AC, SS, SC, CC, and the different types of genotype. So she said, if this student that is said to go and do the genotype test, like not even a student of medical laboratory science, not even a student of microbiology or something of sort, like an auxiliary nurse, someone that maybe she just had SSCE. Some of them even did their secondary this thing, maybe they are art students, commercial students, then they went to learn nursing as a skill. So they will now push her due to some little experience that they've done before her, that you're going to do the genotype test. By the time she did the genotype test, or he did the genotype test, and the result is not clear, my wife said that they will now look at the person that came. If the person looked very healthy, this is my wife, like she said, if the person look very healthy, they just write AA. If the person look kind of sick, and they can write SS. they will just write anything based on the appearance of the person. My wife said that they did this several times. I'm like, so this is the way. And candidly, truly, when they talk about this auxiliary nurse of the thing, the government is strictly against it. And these are some of the reasons. These are some of the factors behind it. Because at least know your level. Know what you are meant to do. Know what your strength and your weakness. How will you push an auxiliary nurse to go and do genotype tests? Like something as serious as this. You'll not be looking at the face. This person look healthy. He will be AA. This one used to have malaria often. He will be AA. This one is very distant. He will be AS. This one is falling sick every day. He will be SS. Is that the way? What is now the essence of going for the test? So the reason for saying this is that this quackery of a thing is not only when it comes to genotype. Even for reproductive health assessment also. Some people, some patients having fertility health conditions, when they go to the lab for tests, there are some mistakes that if the lab attendant that wants to check the sperm cell is not someone qualified, someone that have the experience, the expertise, they will just come up with a result and give it to you. I've seen a patient told me that, send me his test result showing that he has no sperm cell. But I see some inconsistency in the result. Like, you said the patient is having no sperm cells, but you said the morphology is 35% normal. As how? Like, 0 sperm cell, but 35% morphology. That is showing that there is a problem. So I had to tell the patient to go to another world-standard laboratory where it is, an experienced, a highly professional, medical laboratory scientist that will attend to her, that will attend to him. So by the time he sent the results, it shows that he has millions of sperm cells. But the first lab said he's not having no sperm cell, but he's having morphology. So if you are having fertility health conditions and you need guidance on laboratories, quality laboratories, you can go to get your test done, then reach out to me wherever you are. Tell us your location. We will guide you to laboratories around you where you can get the test done. And after doing the test, we will also guide you on the interpretation of the test and the solution to address the conditions in the test results. Thanks so much, the Criterion Case.